Wes Streeting, the Health Secretary, has branded calls to free Lucy Letby crass and insensitive. David Davis, the Tory MP who is campaigning for the evidence against the killer nurse to be re-examined, joins us once again in the Daily Tea studio.
We'll also be speaking to Philip David, Professor of Statistics at Cambridge University, who has also raised concerns about her conviction.
And the NHS is once again in the headlines after a review by Lord Darzi has found progress is going backwards for the first time in 50 years. But why has Labour dropped all its punchy pre-election chat about reforming the health service? Gordon, we've discussed Lucy Letby quite a lot on the Daily Tea. Wes Streeting, the Health Secretary, has said on Sunday that he thinks those who are campaigning perhaps to suggest that Lucy Letby is the victim of a miscarriage of justice are crass and insensitive. The 35-year-old was convicted of killing 7 newborns and attempting to murder 7 others at the Countess of Chester Hospital between 2015 and 2016. Basically, what Streeting is saying is the court case was conclusive, she was denied an appeal, so why do others who have been coming forward questioning the evidence, doctors, statisticians, some politicians, why are they doing this? Because it's only upsetting the family. And at the weekend, one of the families of one of the victims did say, shame on you, to those who have been questioning her guilt.
Yeah, and then we've got the Thurwell inquiry opening today as well, which is examining the events at the Countess of Chester Hospital where Lucy Letby worked. We have to point out that it's not going to make any decisions or conclusions on whether she was guilty or not. It's about what was going on in the hospital in a wider sense. The Telegraph obviously has written a lot in the last few weeks about Lucy Letby and raising questions about her conviction. We spoke to David Davis, people might remember, a few weeks ago, when he said he was not sure whether she might be a victim of a miscarriage of justice. And he spoke to you, Camilla and Kamal, towards the end of last week, when he went even further.
Just to caveat this, Gordon, and make it clear that when we interviewed David Davis last week, it was before family members had spoken out, and indeed Wes Streeting had spoken out against some of those campaigning on Lucy Letby's behalf. But as you will hear, he's going further now than he went with us on the Daily Tea in August, which is interesting. So let's have a listen. At the beginning of the summer, you were with us in the Daily Tea studio. We were discussing your concerns about the Lucy Letby convictions. You said you were going to spend the summer reading up on all of the material you could find, have a look at the reports of the trial, weigh up some of the evidence, weigh up some of the concerns that have been raised to you by statisticians, other medical experts, and come to some conclusion in the new parliamentary term about whether this is a case that you're going to champion. Have you come to a conclusion now?
Yes, I have. I think the balance of probabilities is that she's innocent, not that she's guilty.
Really?
Yeah. I mean, I can't be sure she's innocent, but the way I think of it, and Kamal will like this, it's sort of economist way of looking at it really, is, look, what do we know? We know that in a hospital like this, a neonatal unit like this, 2, 3, 4 babies will die every year because they're fragile, because they're really, really vulnerable. And in this year, depending on how you count the numbers, 15 or 17 died. So you just big spike, all right? And out of that, people concluded there'd been a murder, right? Now, I think there are 4 possible reasons for this. One is that a young woman who dedicated her life to saving children's lives was actually all along a serial murderer or became a serial murderer, and she'd killed them. That's one. That's effectively the conclusion of the trial. Second one is that actually there weren't murders at all. This is not an unusual spike. That's a number of statisticians, some of whom I'd spoken to, have since gone public. Peter Green, past president of the Royal Statistical Society, he contacted me. We had in the Telegraph carried a week or 2 ago a statistician from UCL, a very senior one, saying actually the year before this, 2 other hospitals had spikes like this. Afterwards, other hospitals had spikes like this. This is not that unusual. So it could be that. The third possibility, which I think is the most likely, is that the hospital was systemically flawed. It had not enough nurses, not enough properly trained doctors. The training levels were too low. Supervision was too low. You're supposed to have 2 consultants rounds a day. You've got 2 consultants rounds a week. The consultants couldn't really be contacted after hours, or at least people weren't contacting them. I say those things because they were written up in a Royal College report which wasn't shown to the trial, as far as I can see, wasn't shown to the jury. And the fourth possibility is that there was some external effect like an infection, right? And now, looking back, we found out that there was a Pseudomonas infection recurrent in the water in the hospital, and that can kill vulnerable children. And we know, of course, because it was part of her defence, that also there was sewage backups in the intensive care unit and through the ceiling from the floor above. Oh, it could be 3 of them. It could be all of them. It could be it wasn't that unusual a spike, and it was badly run, and you had the infection and it didn't cope. And it seems to me that they're more likely, frankly, each of those are more likely than the conviction. So that's where I'm at, and it took me 6 weeks, and I still haven't had access to the proper transcript. I mean, this document sitting in front of me, for your audience, is about 1.5 inch thick file, is 1/3 of what we put together in terms of just the run of the trial. We did it from local newspaper coverage and so on. My team has compiled a lot. But I've talked to a couple of dozen experts now, and I'm talking about experts who are more expert than the so-called expert witnesses in the trial. You know, people who've got more modern neonatal experience, more recent neonatal experience, people who know about it, about people who worked with her, people, the statisticians, of course, forensic scientists, and lawyers. And it's persuaded me that this is an exercise that I need to take up for Letby, because I think it's very likely a miscarriage, for the health service, because we should respond to these things not by making a scapegoat of somebody, but by putting right what caused the problem, right? And for the judiciary, because I think it's a very good example of how poorly the judiciary can handle some scientific and statistical and technical data. Indeed, a week or 2 ago, I had an email from a Nobel Prize winner congratulating me on taking an interest in it, and saying he thought exactly that. He thought that was a problem. So a whole series of things. And even, I mean, you may know this already, but even Mike Lynch, who died in that yacht accident, he and I had a celebratory lunch after his trial. He, from California, without knowing I was interested, had looked at it, and as an expert statistician and an expert technical man, had said, I think there's something terribly wrong with this trial. So, you know, the people's views on this are great. Now, don't get me wrong. I had an argument and a row almost in the tea room of the Commons just recently, because people were taking different views. And around a table of 6 MPs, there were 3 including me, 3 on my side, 2 on the other side, and 2 couldn't make up their minds. So that's how divided views are.
Could I just make sure I'm clear? When Camilla, you interviewed David Davis at the beginning of the summer, you were talking about the sort of safety of the conviction rather than her innocence. But from what you have now read, the fact that someone of your eminence, your skills in knowledge of campaigning, miscarriages of justice, you seem to have now gone a step further than that, that it's not just about how statistics are used in court cases, about the safeness of the Lucy Letby conviction, but actually you have said she is innocent. I just want to make sure I'm understanding the journey you've been on.
That's the balance of probabilities, yes. I said to you at the beginning of the summer that I was pretty sure this was an unsafe conviction for a variety of reasons, the statistical weakness and so on. But I wasn't going to pursue that because this will take a lot of time and a lot of investment of effort, but also of reputation in it. But I wasn't going to pursue it if I didn't think that, broadly speaking, they got it wrong, got the actual outcome wrong. You know, it's perfectly possible for a mistrial to get the right person, you know. I think the balance of probabilities now is the other way. It's balance of probabilities. I can't be certain, but I'm more sure than I ought to be.
And what next then?
Now? Well, what next? I mean, you've got the Thurwell inquiry just starting, looking into it. I've already written to them saying your terms and conditions are based upon the presumption that this trial is correct and that she's guilty, and therefore you're doing a bit like the Shipman inquiry. You remember Shipman inquiry and looked into how it was that he could kill 200 people and nobody noticed, sort of thing. Remember that? And I think there are a number of other hypotheses, as I've just outlined to you, and you have to, when you design whatever new system you design it with that in mind, that you get the right answer fast.
You believe the Thurwell inquiry should be paused then for that reason?
Well, not necessarily. I mean, that's one option. Wait and see. But the hard truth is, as I said to you, before the Countess of Chester had their spike, a couple of other hospitals had spikes, and since then, other hospitals have had spikes. Now, in those spikes, what does the spike mean? It means newborn babies are dying. All right. So there's something that has to be done, irrespective of the conclusion of this trial, right? Of the Letby trial, and so it's perfectly possible for Thurwell to go into. She's a very clever person, is the chairman of this inquiry. It's perfectly possible to go in with a sort of slightly more open mind than the terms and conditions imply, and come up with answers which are broader solutions. When Shipman happened, all those years ago, 20-odd years ago, I had a look at that then, and what I recommended and I thought might be taken up was pretty much what the airline industry does. That if a mistake is made by a pilot, let's say he puts the wheels down rather than the flaps, or he does something which jeopardizes, but people survive, they've got a sort of confidential no-fault reporting system, yeah? And the industry in the world which is the safer than it ought to be in terms of technology, it's the airline industry. We have fantastically safe airlines, right? And it's because of that. It's not because the engineers are all brilliant. It's because when something goes wrong, we investigate it properly, and when things almost go wrong, we also investigate it. We need to find a way like that in our health service, and that's one of the things that Thurwell might come out with. In that case, don't wait, get on with it. If that's the outcome, I'm happy for it to happen soon.
Have you had any direct contact with Lucy Letby, and do you plan to?
No, I probably will, but that's down to her, really. I mean, the truth is, I mean, I remember it was quite interesting early on when, you get a lot of backwash when you do something like this, understandably. You say, oh, well, you're only doing it because she's a sort of pretty-looking young lady. That wasn't true of Assange. Wasn't true of Mike Lynch. It's
Gary McKinnon.
Oh yeah, all those people that have been on my list down the years. It's the facts that matter at the end of the day. It's the facts and then the legal process. And I'll be talking to our lawyers, and talking to all the experts, and I'm also going to be looking more generally at the CCRC issue, the way out of
Criminal Cases Review Commission.
The criminal case, the Criminal Case Review Commission has come under some criticism. Indeed, there's a call for its head to resign at the beginning of the summer because Mr. Malkinson, who had been convicted of rape and spent 17 years in prison because they took so long to exonerate him. And he's not the only one. There have been other ones too. I'll come back another time and talk about LIBOR traders, if you like. But so there have been a few of those. So I want to make sure that that's dealt with too. Because if I'm right, if she's innocent, she's in her early 30s, does she want to spend from now till she's 50, and then come out? That's the time when she might have babies, the time when she might get married, all those sorts of things. I want this to happen more briskly than that. So there's work to do on that front too.
But David, you talked about some pushback in the tea room and beyond.
Oh yeah.
Have you heard from the families of any of the victims?
No,
Because
not
this
direct.
is very upsetting for them. I mean, I appreciate that's not a bar to investigating some of these issues, but they thought this was case closed. Now you're trying to open the case. That's inevitably going to cause them so much pain and distress.
Well, two things. I mean, first thing, it's going to be open anyway because Thurwell's going to go through it. I'm afraid Thurwell's going to be taking evidence, probably from some of the parents when they're doing it. So it's going to be in the open domain. But the other approach to this. This is the other reason I hesitate. When we talk, remember, I don't normally take 6 weeks to make a decision on something like this. But the reason I took 6 weeks is precisely I didn't want to do harm in the pursuit of doing good. And I sat and thought about this and talked over it with my wife. And I thought, if I'd lost a child, I want to know the truth, And the reason I want to know the truth is not just some sort of commitment to that, but because I'd want it not to happen to somebody else, And if I'd lost a sort of 30-week baby, I would want the next person in that hospital relying on that hospital to be able to rely on it that their baby would survive. I wouldn't just want revenge. I'd want an answer. And so what I'm trying to get at is the truth. And if it turns out, bear in mind, the maximum I could achieve is a new appeal. A new trial. There's going to be no line put through the thing and release. It's going if I'm successful on this, if I'm right and successful, it goes to a complete new trial. So and then we get the truth. And out of that, plus Thurwell, maybe we'll save hundreds of babies' lives in the future.
Have you got lawyers supporting you? Because obviously she has been through the appeal process and has failed. What bar do you need to get to? I'm interested in the next part of the legal process. As you said, you want to be in touch with Lucy Letby's lawyers, maybe with her family. Yeah. As you say, Camilla, some of the victims' families are going to respond to this in various ways. But the actual legal process from your point of view, David, do you now get lawyers involved? What is the appeals process?
Well, the most likely, at the end of the day, it will be down to her and her lawyers what they do. But their process should be putting together an appeal process, as it were, a new process to go to the CCRC, who will then trigger the appeal court. That's the way it works. Now, to do that, they're going to have to put together a significant set of new experts on all these fronts. And there are a lot of fronts we're talking about. Bear in mind, it was a 10-month-long trial, longest criminal trial, I think, certainly in modern times. And they're going to have to repudiate a lot of very serious evidence. I think that's perfectly possible to do. But that's for them to do. I can't do that, as it were, without her permission or without whatever. That's for them to do, and it's done on her behalf. What I can do is make people aware of the issue and flag up with the various ministers involved Wes Streeting and Tabana and so on. All of the various ministers. Look, these are the issues for your departments, your parts of government, to make sure the health service deals with this better in future and make sure the judiciary deal with it better in future.
Gordon, since we've been covering this subject, it has made me feel a bit uncomfortable as a mum, I've got to be honest.
Yeah.
Because that argument, well, how does he know any better than the jury that sat in the court for 10 months analysing this evidence? The convictions, she is serving 15 life sentences.
Sure.
The journalist in me says, well, hang on a minute, if there's any question over the validity of the evidence that's been used against her, then we should examine it. And I absolutely support our colleagues for doing that. We've been talking about it on the Daily Tea, but when you think about the victims' families, it does make me uncomfortable as a mum, I've got to be honest.
Yeah, and I think David Davis has said he would like to speak to the families. I think that would be useful for him. And I think before he starts to... I think the difference is that at the Telegraph, we've looked at the evidence. We've sort of raised some doubts about some of the evidence that was presented in court. I think David has gone further and said, I'm now effectively convinced that she's innocent. I do think that that is something that he needs to be able to, put to the families, ask the families about, have that conversation with the families perhaps before he goes too much further.
They've had this closure, and now somebody's trying to say case back open, which is so hard for them. Shall we just hear what Wes Streeting said in response to some of those concerns? Because I mentioned earlier, one family of one of the victims had basically said, those questioning Letby's guilt, shame on you. They question the humanity of people doing that. That appeared in the Sunday Times, and then Wes Streeting was asked about it by Lewis Goodall on LBC.
What I would say to campaigners, whether it's Lucy Letby's legal team or any of the others writing letters, there is a judicial process to follow. If you think there is a case, follow the judicial process. And I would just say, out of respect to the families, do it quietly.
But people commenting on social media
I actually think it is crass and insensitive to be waging a public campaign in this way, because we can just debate it, you and I, listeners can debate it, we can read the newspapers. We're not the Criminal Case Review Board. We have an independent judiciary in this country. I think we have a fair and successful independent judiciary in this country. Let the judicial process run its course. There is no purpose to a media campaign. It is for the courts to decide on the basis of evidence. And I would just remind people that, we always presume innocence until people have been found guilty. Lucy Letby has been found guilty on multiple counts of serious crimes with multiple whole life sentences. And until the courts find reason to suggest otherwise, we should continue to regard her as a convicted killer serving multiple life sentences, delivering justice for those families.
Well, joining us now is Philip David, who is Emeritus Professor of Statistics at the University of Cambridge, who's looked into the Lucy Letby case. Philip, what are your concerns about the Letby case?
My main concern at the moment is the pressing need to get the inquiry, which is, as you know, is due to start tomorrow, to take a broad view of its terms of reference. At the moment, the terms of reference seem entirely focused on the idea that it should try and understand what might have been done to catch Lucy Letby earlier, or what systems could be put in place. Obviously, there are lessons to be learnt about what might have been done, so that if there are serial killers on the loose, that they can be caught early. I've got no problem with that. The problem I have is that not wanting to relitigate the Letby case, I do have some problems with it. But in terms of the inquiry, I think a very important aspect is that of the 22 counts on which Letby was tried, she was not convicted on all of them. She was actually convicted on 15, that's after the retrial. On 2 of them, she was found not guilty, and on the remainder, the jury couldn't reach a verdict. So if we take the results of the trial at face value, there are some unexplained cases which are not attributed to murder by Lucy Letby, but nevertheless are worrying because they were unexplained, unexpected deaths or sudden collapse. And in fact, that doesn't even exhaust the number of cases, because when Dr. Evans was asked to review a number of cases before trial, he was actually given a total of 61 cases to look through, all of which had been considered as either unexplained or unexpected cases of death or sudden collapse. So that actually leaves a rather large number of problematic cases which have not been attributed to murder. And what that means is that if we take that seriously, there are some serious problems which need to be investigated, which got nothing to do with Lucy Letby. So that is why I'm really hoping that the inquiry will expand its terms of reference, or take them broadly enough that they will look into what's been happening in this particular unit over and above anything that Letby might have done. We've heard a number of concerns from a number of bodies about problems with the unit in terms of its hygiene, in terms of its staffing, in terms of the seniority and ability of the medical staff. A lot of problems have been raised. So my point is that even if we were to take absolutely seriously, as is perfectly reasonable, the outcome of the criminal case, there is a lot beyond that which still needs to be explained. And if we're to learn appropriate lessons, the underlying circumstances, the possibilities, the causal factors need to be properly researched and thought about.
Professor, do you share the concerns of other statisticians in the statistical evidence that was presented to the jury?
I do have some concerns, although I'm going to tell you right off, I haven't done a very close look at the statistics, but I'm aware that there have been some concerns, particularly about the roster, the table that was presented of who was on duty when various babies were found dead or unresponsive. So one thing about statistics is if we're going to interpret data, then the science of statistics tells us an important thing. We can't interpret data without understanding how the data were generated, where they came from. The whole thing of the process of producing the data is absolutely fundamental to understanding the data. So we need to know how those numbers came to be in there, how those particular cases were chosen. And until we really have a proper understanding of that, the data, it's difficult to take the data at face value.
And you mentioned the 61 deaths. Is that
no, they weren't all deaths. They were deaths or sudden collapse. They were unexplained incidents, serious incidents.
Yes. And are you saying that was evidence that the jury was not told about, or was that introduced into court?
That's something I can't answer. I'm not aware of that. But these were cases which were reviewed by Dr. Evans ahead of trial, and I think, I don't know if he was personally or uniquely responsible for deciding which cases deserved further attention, but certainly there were many which were still classified as unexplained or unexpected, which were not then considered in the trial.
So are you saying that because the inquiry has said that it cannot take a position on Letby's guilt, it then means that it's too narrow to make a proper assessment of the cases in which she was cleared?
Well, I'm not sure if they've said they can't take a position on the guilt. My understanding is that they work on the assumption that the outcome of the criminal trial is to be taken as fixed. But what I'm saying is that even accepting that, there are other issues, there are other problematic cases which really ought to be considered seriously.
Professor, what's your response to the bereaved families who've said that over the weekend they've come out very strongly against the idea of people sort of investigating the trial? They used the phrase "shame on you" to describe not you, but people who have been, particularly on social media, trying to go over the evidence again. What would you say to the families?
Well, I know where they're coming from. I can understand and sympathise with those feelings, obviously, but it's a separate issue from really trying to understand what's been happening, which I think is important. But as I said, I'm not at the moment really concerned with the safety of the conviction. Doubts, although I'll say I have my doubts, but the wider point that even taking that as fixed, we have other issues, and I do really hope that the terms of reference of the inquiry will be considered broadly enough to include these further issues.
So at the moment, the terms of reference for the inquiry is to look at the events at the Countess of Chester Hospital and the implications on the back of the trial and conviction of Lucy Letby. How much wider would you like it to be? What addendum would you put on that?
Well, while they are looking into the procedures, the personnel, the environment, the whole context in which these deaths and serious collapses occurred, I mean, it would be appropriate for them to spread that widely enough to consider what other factors might have been leading to unexplained and unexpected deaths in the unit, whether or not some of those can be attributed to murder by Letby.
Professor, thank you very much indeed for joining us on the Daily Tea today.
Very good, my pleasure.
Thank you.
Thank you, Philip. Coming up, as a root and branch report finds that NHS progress is going backwards for the first time in 50 years, we're going to be discussing whether Labour is brave enough to reform the health service.
Gordon, it's all over the front pages. This major report by Lord Ara Darzi, a surgeon and former health minister. It's going to be published later this week, but it's already making headlines because, my goodness me, it gives a damning review of the state of the NHS. I think we accepted that post-COVID things would be in a bit of a bind. We know that waiting list figure keeps on going up, not down. I suppose the question, though, is, and this has been the question for as long as you and I have been journalists and beyond, how do you solve a problem like the NHS? How do you solve a problem of a health service being crippled by an increase in population, by an increase in our ageing population, by junior doctor strikes, by the NHS effectively being closed down just to deal with COVID patients between 2020 and 2022? How does it catch up and what can be done?
Yeah. And Labour talked quite tough on this before the election, didn't they? Wes Streeting himself got a lot of credit for saying, Labour will reform the NHS. It does need reform. And a lot of people thought that only Labour can do that because if the Tories try to do it, they get accused of trying to privatise the NHS. So we've been expecting big things of Labour. Now they're in power and they seem to have gone quite quiet.
Should we be reminded of what Wes Streeting told Kamal when he interviewed him for the Daily Tea during the election campaign? Because he obviously asked him about this issue of reform. And let's be honest, Streeting was pretty punchy.
So I've tried to kind of emphasise the importance of reform because, you never need to persuade people generally that the NHS could do with more money. You always need to persuade people that more money is not in and of itself the silver bullet. You've got to reform the way it works. Otherwise, in the longer term, you look at rising chronic disease, growing ageing population, rising cost pressures. These are long-term existential threats to the National Health Service.
So there he is saying that only Labour can be trusted to reform the NHS, but I thought it was incredibly striking that once they got into power and once we heard the King's speech setting out their priorities, social care didn't appear in it at all. The word social care were not in the King's speech, despite the fact that they had talked about a national care service in their manifesto. And I think the problem is that we've heard fine words from Keir Starmer over the weekend. He's talked about reform again. We don't really know what that means. They will argue that the Darzi report is going to tell them what reforms are needed. But we all know, and anyone listening to this will know, that unless you reform social care and unless you fix social care, you can't fix the NHS. They are two things which should have been joined when the NHS was first brought into being in the 40s. They weren't. And, pretty much anyone who's listening to this will have had experience of social care either probably through a relative who has been, either in a home or had to have care at home. And it needs to be funded properly, and nobody wants to do this, and including not Labour.
No, exactly. The Tories said very little about social care because they were stung by the criticism of Theresa May's so-called dementia tax back in the day. By Labour, ironically. Yeah. So we had the Dilnot report, which basically said we need a system whereby social care costs are capped at a certain amount, that everybody in the UK needs to accept if they have the assets that they might have to spend up to 86,000, 100,000 on care, and then the rest of the cost would be covered by the state, because we did have this situation of inequity. If, unfortunately, an elderly relative has cancer, their care is paid for by the NHS. If they get dementia or Alzheimer's, it isn't. And then you get into the situation, particularly for the Conservatives, it's problematic, this idea of people having to sell their home to pay for care, when the Tories are all about aspiration, buy your own home, bequeath it to your children, and that becomes a difficulty. Why do you think, as you said earlier, of all parties, Labour could push these reforms through with the support of unions, not least now they've given them a pay rise? The only person that's spoken any sense on social care is Ed Davey, the Liberal Democrat leader. And that may well be, Gordon. I know there were other reasons for why people voted yellow in the election, not least their disgust with the Tories in the Tory shires. But I think what he was saying about caring and social care really appealed to that blue wall demographic of people who we know, we can guarantee, have been looking after mum or dad in recent years?
Yeah, it does feel as though the answers are out there. Dilnot, you and I talk to politicians all the time. They bring up Dilnot all the time because they say, oh, well, we just need to look at Dilnot again. We just need to come up with a version. All we're talking about really is a number. They need to pick a number. They need to decide where either the ceiling is for the maximum you pay into your care, or where the floor is, where you're allowed to keep X amount of your assets, and then the rest of it goes to the state. It's pretty simple. They just have to choose. And it does feel sometimes as though they're treating people like children because they don't want to have to give them bad news. Everyone knows, though, that the whole system is wrecked. It's not working. Social care is the thing that is gumming up the health service because there aren't those places in beds in care homes to get people out of hospitals. That ends up with people waiting in ambulances at the other end of the hospital. We know all this. So they just need to grasp the nettle, tell us how much it's going to cost, and then get on with it.
On the care homes front as well, care homes closed down during COVID and haven't been replaced. Care homes, of course, have also had to grapple with the cost of living crisis. So you're finding that over the course of the last year or two, they've had to put their fees up to cope with utility bills literally doubling.
Yeah.
And therefore, that has become less accessible. I mean, it's a sorry state of affairs, isn't it, that we live in, the fifth or sixth largest economy in the world. I don't know about you, but I sort of live in fear of something happening to my parents because you just don't think that this state that we've paid into for all of our working lives is going to be there to pick up the pieces if the worst happens, Gordon.
No, it's not. My aunt died in a care home earlier this year. My mum died in a care home. So I've seen this very close quarters. But I accept that it's not cheap, and you and I were talking before we came on about the problem with paying care staff as well. That they are by and large paid minimum wage. That was part of the reason that COVID spread in care homes because they were having to go from one home to another just to make enough money to get by. And care homes are losing staff to Sainsbury's and other places where they can get a few pounds more per hour than they're being paid now for, quite frankly, a less arduous job. So we know this. You talk to people who've got relatives in care homes, they know this. They know that the staff are brilliant, but they don't get paid properly. They know that more money has to go in. Unlike the NHS, where Streeting is saying it's not all about more money, I'm afraid with social care, it by and large is all about more money. And we know that we're all going to have to contribute somehow. So just tell us what the answer that you've come up with is.
He's made pledges about getting the waiting list down, and before the election, he was talking about the idea of a degree of part privatisation. It's been a Labour attack line on Tories for years. Oh, you're trying to privatise the NHS. He's merely making the point, which, funny enough, I agreed with, that you can get private contractors to come in and, for instance, get waiting lists down by carrying out some hospital operations sort of in a private facility, but on the NHS. That strikes me as making perfect sense. You know, it's kind of an echo of PFIs in Tony Blair's reign. Yeah. Very, very unpopular with the hard left element of the Labour Party.
Yeah.
But makes sense. Also, money wasting in the NHS is such an issue. A little bit like the BBC, because the money just comes in. The money always comes in. We had a report about 3 months ago suggesting that despite record investment, record recruitment, productivity in the NHS is still going down and has never recovered from the pandemic, which is... So he's right, and he's appealing almost to Telegraph readers in saying, you can't just pour in more money. But haven't people talked in the past about we need a royal commission?
Yes.
What does that do, Gordon? Would that help?
Well, the idea with that is that you get a truly impartial group of experts who look into the whole way the NHS is run, the way it's funded, the waste, as you say, the productivity. They come up with a set of answers which is then non-party political because hopefully they are genuinely independent. And then it makes it much easier for the party in power to say, well, look, these are the answers they've come up with. These are people who know what they're talking about. We'll put this into practice, and then it's much harder for the other parties to push back. And ideally, you get all political parties to sign up to the Royal Commission before it even starts, so that you say we'll all vote for whatever they come up with. That's the idea.
We know you'll have strong feelings on this, so do get in touch. What's your experience of social care? Maybe you've experienced the NHS lately. What do you think needs to change? Have you been a patient? Are you looking after a patient? Let us know. You can get in touch on email, thedailyt@telegraph.co.uk, or across all of our socials, Instagram, TikTok and X, @Daily T Podcast.